everybody, this is Stacy Pace with Spectrum, the other clinic. Today I'm going to be talking to the fellas out there, or anyone who happens to be on testosterone therapy, no matter how you identify. So, a lot of people kind of wonder what happens whenever you go on testosterone, how it can control the menstrual cycle. I know that word can kind of bring on some dysphoria for some folks, and you don't really like to think about it, but the reality is it's here. Sometimes it's hard to deal with, and it keeps happening even though you're on T. So what do we do to help stop that cycle going on? So there's a few options here, not to get too extreme. I mean, there's all kinds of options up unto getting a hysterectomy, which is what ultimately will solve all of that. But before we get there, because I know a lot of people can't just walk out and hand over a wad of cash and say, here, take my uterus, we're going to deal a little bit more realistically for now. So whenever I have a patient who has a uterus and I put them on testosterone therapy, I always counsel them about the effects that it's going to have on those parts of theirs, which are many and varied, by the way, and I'll probably do a whole nother talk about that in specific as well. But otherwise, if I have someone come to me and I put them on T, and let's say for right now we're talking about like full dose therapy, someone who wants full masculinization effects, not like non-binary or whatnot. So I put them on T and they say, yes, I still have a cycle, and I'm like, okay, I'm gonna wait till probably around the 6-month mark before I say, okay, if it's still happening, we need to do something about it. Because T can stop the cycle within 1 month. Like, it can stop it cold. But for some people, it will drag on a little bit, become irregular, or become really heavy, or just spot, or whatever. It gets kind of crazy for a little while whenever you first get on. But when it hits around about the 6-month mark, I mean, give or take a month or two, whatever, it should, if it's going to, it should be stopping almost altogether then, or be altogether done. If you reach a year and you're still going, well, that's just crazy talk. Nah, anyway. So whenever you hit around the 6-month mark and you tell me you're still having cycles, what do I do? Number one, there's 2 options, and it really depends on which one you're more comfortable with. Both of them are well tolerated. One is a typical birth control pill called norethindrone. I spelled that right there because it's a funky word to say. But anyway, so norethindrone is typically used as a birth control pill. It's not an estrogen containing pill, though. It does not have estrogen. What it has is a progestin in it. And I mean, both men and women have these hormones in them to some degree anyway, so please don't feel like I'm throwing another, girly hormone in you or something like that. It's nothing like that's gonna feminize you or anything like that. But what it will do is get in there and hopefully stop that bleeding. Now, it doesn't work like that. It can take, a couple of months or so to work in. So what happens if that doesn't work? I'm going to want you to be on that for probably about 3 or 4 months and then say, it's still going on before I call it quits on that medicine, because it does take time for that one to shut everything down, because a lot of what it has to do with is it's going to be changing the blood supply down there and everything, and that takes time. But anyway, so if that doesn't work, my next go-to is going to be aromatase inhibitors, just for example, anastrozole. So what are aromatase inhibitors? Well, to start with, aromatase is a particular enzyme that you have in your body that converts testosterone into estrogen. And what it's going to do is it's going to mess with how much estrogen you get to have in your body, essentially, because a lot of what your estrogen supply comes from is actually from testosterone being converted into estrogen. And so it's going to get in there and kind of mess up that process so that you don't have as much estrogen being produced in the body as before. And the cycle is highly dependent upon hormones and whatnot, especially estrogen. And so whenever you get in there and you mess up that part of the cycle, a lot of times then you will see a cessation of bleeding. That's another one that I would say give it about 2, 3, 4 months, that if it doesn't stop the bleeding at that point, there's other things you can try. And also back on the norethindrone, you can also use such things as like a Depo-Provera injection. That's that birth control injection. It's kind of similar to the birth control pill I'm talking about, that norethindrone. You get it in an injection instead, though, about every 3 months. Works about the same, although some people respond better to one or the other. So I mean, it's kind of, you know, if you fail one, it doesn't mean you would necessarily fail with the other. So you may go and try that if you try one and it doesn't work. But anyway, if at that point, you know, those don't work, there's also other little things, like depending on the dose of tea that you're on. If you're on a relatively low dose, or if your T levels aren't quite high, but they're within normal limits, like they're within good enough limits for transitional purposes, but you're not maxed out, let's say. So, I mean, like I'm looking between like 400 and 800 for a total testosterone level. And let's say that you're always hitting between 400 and 500, which is perfectly fine for transitioning. But maybe if we took you a little bit higher into the 600 to 700 range or whatever, maybe then we could actually shut down that process that's causing the cycling to still be going on, because there usually is a set point in everyone. It's just like it's dose dependent. You find the dose that works to shut down the cycle, and there you go, problem solved. Unfortunately, some people's set point can be so high that the dose of testosterone is it's going to become problematic, because then you'll be harming yourself in other ways with such a high dose of T. And also, once you start getting up into the more elevated ranges of T, like over 1,000 and stuff like that, your body will actually start looking to convert some of that T back into E to help balance things out, and that's not what we want to do. So, so there is some limit to going up on your dose or raising your levels. There's some limit on how high we can take that to where we reach a point of diminishing returns and actually get into a point of harm at one point. So anyways, so that's another option to try out, either before or after the other things fail. It just kind of depends on the person and what's going on with them as to which one I would try first. And like I said, there are other options out there. Like I don't typically do this at my clinic because I'm not trained for it. You know, the intrauterine devices, those kind of birth control devices, you can get those. You can get the arm implant birth control device. Those works, you know, similarly and can help. Let's see. Then there, of course, there's the hysterectomy. But at any rate, you know. Oh, and you'll also see, sometimes you'll see mentions, SERMs, S-E-R-M, selective estrogen receptor modulators. They are sometimes used, but they are not generally considered the best choice because of the potential side effects from it, which, I mean, can include cancer, polyps, worsening of if you have cysts or anything like that. Also hyperplasia, which just means like your tissue down there overgrows and everything and can be quite painful. So those kind of medicines, not exactly a good choice. And then there are the GnRH analogs, which are like what you would see trans youth get, the Lupron shot. However, I will say, like, once you start looking towards those become so expensive, and they're very difficult to get insurance to cover, you know, in adults especially. It becomes kind of cost prohibitive. I mean, if you went for like they have one, it's like Lupron, but it's an implant that you put in, it lasts for a year. And if you go for that, I mean, that's like, if you paid cash for it, it's like 20,000 plus bucks. You may as well just walk up and tell someone, I want my uterus removed, here you go, and you might pay, you know, $8,000 or $10,000. So, and then you wouldn't have to go back every single year and pay another $20,000 for this implant. So some options are kind of not very realistic, but they are out there. Anyway, so these were just kind of the general options that are out there in case you're still having some cycling and whatnot while you're on T. Now, for those non-binary folks out there that are on the lower doses of T, Ooh, I feel for y'all because that cycle can get all kind of crazy. The same options are out there for you as what I just mentioned. Um, it's just that usually y'all are going to have a little bit harder time doing anything with testosterone alone because we can't get your levels up very high, or else, you know, you're not going to be doing non-binary transition anymore. You're going to be doing full masculinization. So that's not really much of an option. The other stuff like the aromatase inhibitors, like anastrozole, that's an option, or the birth control stuff like the Depo-Provera shot or the norethindrone pill. Those are certainly options. And there are other different like birth control stuff that you can use. You can even use an estrogen progestin combined pill. I just know a lot of people don't, want to put any kind of estrogen in themselves when that's essentially what they're trying to get away from whenever they're doing any kind of masculinization. But anyway, so all you folks that do the non-binary lower dosing testosterone therapy, you do have similar options out there. It's just, like I said, sometimes y'all have a little bit more difficulty because that testosterone level is not up high enough to lend a hand and help. It's usually just high enough to make the cycle go insane. And so some people end up and they're just really irregular and they only have one every, 3 months. And then some people have one almost every 2 weeks and they're just like, oh my gosh, I'm going to lose my mind. Now the people who get this, it's less than like 10% of folks on full masculinization doses that end up with this issue. About maybe twice that with the non-binary folks. But anyway, but it is a common enough problem that folks are always asking about it. So anyway, I hope that this helps someone out with kind of figuring things out. If you're out there and you're wondering if your cycle's ever going to stop, or if you need to ask a question about it, or if you need to look into some of this stuff to have done. I hope it really helped out. If you have any questions, though, of course, I'm always here. You can write to me. Let me know if there's any other topics you want me to talk about. And until then, bye-bye.